as with our size, help shape that standard.
So if you have the pathway for sharing data and you have the tools and resources to make it accessible, whether you're using standardization or some form of upcycling to remove redundancies or obsolete information, the next big challenge is identifying, as you said earlier, how are you going to use my data for my benefit as a patient, as a consumer? So I was wondering if you could talk to me a little bit about your process for thinking about where that patient's data should go to the benefit of their providers as well as the consumer themselves.
So some of the first big, in the sharing of data, the first kind of domain I can think of is in our population health space, is getting that. And again, not just the clinical data, but those social determinants of health, to look at our members and say, what are their needs, both from a physical perspective, a behavioral perspective, and a financial perspective. And I'll take it one step further. Again, if you think of Maslow's hierarchy, do they have food? Do they have shelter? Because they're going to say, you know what? I don't care about my medical condition if I can't eat or I don't have a place to live. So being able to have those type of insights, I think of it, we do transition of care within our Medicaid space as they move from one payer to another. But we send a document. What do we really do with that? It's mainly around our authorization data to make sure that the authorizations that were opened with the previous payer come into the new payer. And that's about the biggest extent that we use it. We have that opportunity to go far beyond that with plans of care, ensuring that they have everything that they need from that perspective. I think the biggest thing, our biggest challenge that Amanda and I have on a regular basis is we're both innovators by nature, I think. But to innovate, and organizations say they want to innovate, our industry says it wants to be innovative, but to be innovative, you've got to be open to change. And just because this has been our process for the last 10, 15, 20 years, doesn't mean it doesn't have to change given, where we're at today as an industry,